The Inflation Reduction Act, recently approved in the Senate, calls for lowering some health care and prescription costs, but some say the bill is leaving behind a group of people who need help the most. Kayla Schmidt reports.
James, the piece of legislation that didn't pass by that 57-43 vote is capping insulin at $35, which has people like parent Chad Baker not only worried about the financial impact, but also the health impact. Baker has two children, 13 and 16, both with type 1 diabetes. He says the loss of insulin was not surprising but upsetting. His children were both diagnosed before the age of 3 and have had to use insulin all of their lives. Luckily, Baker has health insurance to cover most of the costs, but he says if he didn't, he wouldn't be able to pay, and that would risk the lives of his own kids. He says many people in the U.S. are already facing this impossible decision.
One of the things that my wife and I both have commented on is, obviously we see what those costs are that are being covered. And we've seen that, my daughter was diagnosed in 2007. And, we're talking 15 years later, it has been a significant increase. We're talking, like I said, not just tens of dollars per year. We're talking hundreds, if not close to thousands of dollars per year.
Now, one of the Republicans that struck down the insulin cap was Pennsylvania U.S. Senator Pat Toomey. The bill in question did allow Medicare to negotiate some prescription drug prices and set a $2,000 annual cap on drug costs for seniors. In the newsroom, Kayla Schmidt, ABC 27 News.